All right, welcome back. You know, social gatherings continue to ramp up as we head deeper into the holiday season. And with that, so does what's going around.
Oh, yes, it does. And right now, we know that cases of flu, COVID, RSV, they're on the rise here in Houston. But there are precautions that we can take to stay healthy. Dr. Michael Chang, a pediatric infectious disease expert with UT Health Houston and Children's Memorial Hermann, is here with us this morning. Thank you, doctor, for being with us.
Happy to be here.
Okay, what's the best way, would you say, first off, that people can protect themselves from all the things that are going around? Because everything's really going around right now.
Yeah, so I like to think about protection in kind of universal things you can do and then pathogen specific, right? So the universal things we all know, good hand hygiene, covering your cough, covering your sneeze, hand hygiene after that, you know, and I can't emphasize hand washing and hand hygiene enough, right? Just basically from October to March, hand sanitizer with you all the time. And then use it frequently and use it properly. With hand sanitizer, you actually need to let it air dry on your hands so that the exposure of the alcohol is long enough to actually kill the viruses and the bacteria. So
interesting.
You don't want to just squirt it on and then like wipe it off.
Should we be scrubbing it or just kind of let it?
So
I mean,
you want to make sure you
your...
cover everything, right? Okay. So fingertips especially, because that's what you're touching everything with. And most of these respiratory infections that we're talking about during this season, viruses and some bacteria, are spread by contact and kind of larger droplets. Now, COVID and flu may be more airborne, but most RSV, some of the bacterial pneumonias, it's really like that contact and the droplets. So good hand hygiene on your fingertips. Again, avoiding kind of close, crowded gatherings if you're actively sick, right? Like not going out when you're actively sick. You know, we're blessed in Houston to have decent winter weather.
Right.
And so if you can have your family gathering outdoor, good ventilation. So those are the universal things.
Okay.
And then there's the pathogen specific things, right? So I tell everybody, regardless of age, kids to adults, make sure your basic kind of health things are taken care of, and then go get vaccinated against all the things that you should be up to date for. So whether it's shingles, which isn't really a respiratory thing, but you know could affect it could affect you during this time. Bacterial pneumonia vaccines. You know, make sure you're up to date on all your vaccines, and then for the specific things during this season, flu, COVID, RSV. You know, start talking to your providers, kind of assessing your risk, what your tolerance for that is. But right now, I mean, unfortunately, RSV is kind of already raging in our community. And we probably peaked this week or last week already. Parents who've gone to their, you know, emergency department or their pediatrician know there's already long wait times. It's hard to get appointments. Hospitals are full. So that's RSV. So, you know, unfortunately, that's kind of already out there in the community. But there is an adult vaccine and a maternal vaccine that can help protect adults and moms from severe illness. And the other advantage of moms getting vaccinated with RSV vaccine is that it can protect newborns when they're born, because the mom can transfer some of her protective antibodies to the baby. And then there is flu vaccine, of course. We talk about that every year. And unfortunately, we don't have a universal flu vaccine yet, so we do still have to get vaccinated every year. But flu vaccine is the best tool that we have, other than those, you know, the hand hygiene and all that we talked about. But it's the best tool that we have to protect against severe illness complications.
How has this year's shot been? Has it been effective?
Well, it's still early in the season. So flu is just starting to increase in the Houston area. And so we are starting to see hospitalizations from it. The numbers are going up, but to this point, we haven't had a ton of flu. It's mostly been RSV circulating in our community. What we can you know, get some insight from the southern hemisphere, because you know their seasons are opposite of ours. The flu vaccine was, you know, maybe 50 to 60% effective, but we always have to talk about like what that's measuring, right? So what you really want is that protection against severe illness, medically attended flu. And so, you know, for me, 50 to 60% reduction in having to see the doctor or becoming severely ill, that's worth it, right, to me. Even though on the surface, you're like, well, I might still get the flu.
Well, it's like half and half, but it's not really like that.
But that's
it's
not
about,
exactly what you know, we're measuring. And then, of course, COVID vaccine, which was updated, you know, this year with the new variant. All kinds of variants are circulating, and it's difficult to know whether any of the variants are more or less severe. And so the good thing is it doesn't seem like any of these new variants are causing worse disease, right? And so that's good. And we haven't seen a lot of COVID circulating in our community right now. So we're kind of in like a lull. But, you know, the last few years, we always had a surge in the winter. People get together. So with COVID vaccine, again, recommend everybody get up to date, especially, you know, kids try to be up to date if possible on their COVID vaccine. I know some pediatricians don't have as much supply, and some parents are having trouble, getting their kids vaccinated. So talk to your providers and see what.
Now, we've heard some of that with even general medicines this year too. Shortages.
Well,
of
yeah,
various
that's a whole
other
different
issue.
Yeah, medication shortages are a huge problem, but that's like days of discussion. Right?
Yeah,
Sure.
Yeah. So again, just the universal basic things: good hand washing, good hand hygiene. Try not to go out when you're sick. Try to avoid exposing other people when you have symptoms. I know that's easier said than done. And then getting up to date on your vaccines. That's really the best way to protect yourself from severe illness.
Yes.
We're always yelling at the kids, stop touching your
always
face.
yelling,
Stop.
wash your hands, wash your hands, and they think I'm crazy, but
No,
it's
it is.
good.
Hand washing and hand hygiene is still the foundation of all kind of infection prevention.
And one quick, back us up on this when we're telling our kids, don't touch your eyes, your nose,
Yep.
your mouth. I mean, these are all your ears. I mean, what? Anywhere. I mean,
eye, nose, and mouth are the most kind of vulnerable spots,
Yes.
right? And so, because those are what we call mucous membranes, so your eyes, your nose, and your mouth. And so the viruses are able to kind of get into your body easier from those places.
Yes.
And so again, avoid eye, nose, and mouth.
Yeah.
And I will say one last thing. Some people say, well, I never get the flu, and so I don't get the flu vaccine. And that's fine. Like maybe you don't get severe flu from the flu, but having a respiratory virus infection could set you up for a more severe bacterial infection, right? And so by getting vaccinated against these viruses, it could also potentially protect you from other like bacterial pneumonia or sinusitis.
Yes.
Oh, wow. Okay.
Yes. All right. It's all about
more
prevention.
more than just the flu.
Dr. Michael Chang, thank you
Yes,
for all
absolutely.
this great advice. Tis the season for sure. All right. We'll be right back after this.
Thanks, Doc.
Yeah.